After our discussion today, everything I mentioned will be included in your written instructions. When you review them tonight, it'll help reinforce what we've covered. If you have any questions, jot them down on the back of the sheet, and we'll give you a call tomorrow to follow up and address any concerns. Unless instructed otherwise, now that you've taken your medication, there's nothing more for you to take tonight related to your transplant. Just go home, relax, have a nice dinner, watch something you enjoy, and take a moment to appreciate the progress you've made today. You did great, and everything went as well as we could have hoped. In your bag, you'll find a few items. These are for protecting your pillowcase over the next few nights. Place the blue plastic side down on the pillow with the white cotton side facing up to rest your head on. We'll discuss how to use this in a moment, but make sure you bring it home with you. Tomorrow will be a day off from showering and shampooing. We'll give everything time to set in. However, we'll need to do a few minor things related to your hair transplant. When you wake up, remove the tape from the wraparound bandage and it will easily come off. You don't need any bandage after that. I'll send you home with 1 additional dose of antibiotic to take with breakfast and 5 days worth of a non-narcotic discomfort medicine called celecoxib. You've already taken a loading dose of celecoxib before leaving the office. So tomorrow morning, take 1 celecoxib with breakfast along with the antibiotic. Take another celecoxib with dinner and then as needed after that. Starting tomorrow, you'll need to use a cool pack. If you have a gel pack, use it. Otherwise, a bag of frozen peas or corn wrapped in a damp kitchen towel will work. Apply it to the back of your head for 10 minutes, then move it to your forehead for 5 to 10 minutes. This helps prevent puffiness, especially around the forehead, which can occur for up to 5 days after a hair transplant. Repeat the use of the cool pack 3 to 5 times tomorrow, using it at 2 to 3 hour intervals. If you do notice forehead swelling, apply the cool pack to the forehead for up to 15 minutes every hour or 2 throughout the day. The use of the cool pack should eliminate forehead swelling within 24 hours. For the next 5 nights, try to sleep on your back or your side with a pillow or 2 to slightly elevate your head. Avoid sleeping on your stomach, as this can increase the chance of forehead puffiness. For the next 5 days, try to keep your head above your heart level to avoid forehead puffiness. When picking up objects, squat down like a baseball catcher instead of bending over. This helps keep your head elevated above your heart level and decreases the development of forehead swelling. From now until a week from tomorrow, avoid any activity that raises your heart rate or causes you to breathe heavily. 1 week from tomorrow, you'll have no restrictions on physical activity. For the first 72 hours, avoid wearing headphones, hats, or anything that could touch or scrape your scalp. After that, you can wear a hat if necessary, but put it on carefully and remove it gently. Starting the day after tomorrow, you can begin showering and shampooing. Before stepping into the shower, wet a washcloth and place it over your transplanted area as a barrier. Use the shampoo provided, creating a lather in your hands, and then gently pressing it and patting it into the wet washcloth from front to back. With open hands, press and pat from front to back for 1 to 2 minutes. The shampoo lather will cross the wet washcloth and cleanse your scalp and help to soften and remove any scabbing related to your procedure. Rinse the lather out of the washcloth by pressing and patting with open hands again under the water stream for 1 to 2 minutes. Dry your transplanted scalp by pressing and patting with a towel. Avoid using hair products like gels or sprays for at least 72 hours. These can cause the hairs to stick and potentially dislodge follicles. Finally, take monthly photos to track your progress. Take 1 photo straight on like a selfie and another from above showing the crown. Start tomorrow and continue on the first day of each month for a year. This will help you see the gradual changes and keep you encouraged throughout the process. You'll begin to see the changes in about 2 months. That's it for now. Review these instructions tonight to reinforce everything we've discussed. We'll give you a call tomorrow to check in. Thank you for your patience today, and we're excited to see the great results you'll achieve.